Hello dear students, today we will be talking about antihypertensive drugs. Hypertension is defined as persistently elevated arterial blood pressure, and it is classified into pre-hypertension and stage 1 hypertension and stage 2 hypertension. If the patient's blood pressure is the systolic blood pressure is between 120 and 139, while the diastolic blood pressure is between 80 and 89, that is pre-hypertension. While if the patient's blood pressure is between 140 and 159, while the diastolic blood pressure is between 90 and 99, that is stage 1 hypertension. But if the systolic blood pressure is more than or equal or more than 160, while diastolic blood pressure is equal or more than 100, that will be stage 2 hypertension. Hypertension is divided into primary or essential hypertension and secondary hypertension. The primary hypertension is when there is no identifiable cause for the high blood pressure, and this type consists of more than 90% of the patient's blood hypertension. That is why a screening of blood pressure should be performed once a year in adults which are 40 years old or elder, while the younger adults with normal blood pressure and no risk factors for hypertension can be screened every 3 years. The second type of hypertension is called secondary hypertension, and this type it is when it is caused by certain conditions or certain medications. The conditions can be like primary aldosteronism, Cushing disease, pheochromocytoma, renal artery constriction, or like medications like oral contraceptives, cyclosporine, tacrolimus, non-steroidal anti-inflammatory drugs, or erythropoietin. Some of the risk factors for hypertension include stressful lifestyle, high dietary intake of sodium, obesity, dyslipidemia, diabetes, smoking, age, and also black race and family history of cardiovascular disease. And the goal for the treatment of blood pressure according to GNC 8 guidelines are if the patient is elder than 60 yes, the systolic blood pressure shall be less than 150, while diastolic blood pressure shall be less than 90. While if the patient is young, like less than 60 years old, or if they are diabetic, or if they are chronic kidney disease patients, the systolic blood pressure shall be less than 140, while the diastolic blood pressure shall be less than 90. So before starting patients with antihypertensive drugs, lifestyle modifications are recommended, like weight loss if they are obese, limiting alcohol intake, also reducing the sodium intake, and maintaining adequate intake of dietary potassium and calcium and magnesium. Also, if they are smoking, to quit smoking, and physical exercise at least 30 minutes daily for most of the days are recommended to all patients. So, because arterial blood pressure is directly proportional to cardiac output and peripheral vascular resistance, and that this cardiac output and peripheral vascular resistance are controlled mainly by two mechanisms, which are the pyroreflex and also the renin-angiotensin-aldosterone system. That's why most antihypertensive drugs lower blood pressure by either reducing the cardiac output and or decreasing the peripheral resistance. If we start with thiazide diuretics, these drugs are mostly the first-line drug, and they are some of the drugs that in this group are the chlorothiazide, hydrochlorothiazide, chlorothalidone, intobamide, and metolazone. The mechanism of action of these drugs are that they inhibit the sodium chloride transporter in the distal tubules, and this will lower blood pressure initially by increasing sodium and water excretion. This will cause a decrease in extracellular volume, resulting in decrease in cardiac output and renal blood flow. And they are appropriate for mild to moderate hypertension with normal renal and cardiac function. The second group are the loop diuretics. These diuretics are the furosemide, torsemide, bumetanide, and ethylenic acid. They act by inhibiting the sodium-potassium chloride co-transporter in the thick ascending limb, and they are used in severe hypertension when multiple drugs with sodium-retaining properties are being used, or in the renal insufficient patient or the cardiac failure or cirrhosis in which the sodium retention is very high. The third group are the potassium-sparing diuretics. This group are the amiloride, spironolactone, ibuprofen, and trimethoprim. These drugs they interfere with the sodium-potassium exchange at the distal convoluted tubule of the kidney, and they are useful to avoid excessive potassium depletion. And other antihypertensive drugs are the aldosterone receptor antagonists. These drugs are the spironolactone and ibuprofen. They are also potassium-sparing diuretic, by the way, but these drugs they have another mechanism of action, which are like they bind to the aldosterone receptor and they antagonize it, like they stop the effect of the aldosterone. So they have a favorable effect on people with cardiac function. On patients with heart failure, especially spironolactone. It has the additional benefit of diminishing the cardiac remodeling that occurs in heart failure. That's why it is very recommended for heart failure patients. If we skip to the beta receptor blockers, they are divided into main four groups. Like the first one is the non-selective beta blockers, which block both beta 1 receptor and beta 2 receptor. This group are the propranolol, nadolol, and cartilol. Also, there is the selective beta blockers, which block especially beta 1 receptor blockers, which are found in the heart. And these drugs are the metoprolol, atenolol, petaxolol, and bisoprolol. Also, there's the partial agonists, which are the pindolol, acylbutolol, and penbutolol. Also, there's the beta blockers with vasodilating effect, which also block the alpha-1 receptor blockers, and they are labetalol, carvedilol, and nebivolol. Beta blockers are the first-line drugs for hypertensive patients and which have the most myocardial infarction. And selective beta 1 receptors may be advantageous in hypertensive patients who suffer from asthma, diabetes, and peripheral vascular diseases, because they will not block the beta 2 receptors, which are mainly found on the kidney and bronchial smooth muscles. Another important group in an antihypertensive group are the angiotensin converting enzyme inhibitors. These drugs are the enalapril and captopril, lisinopril, and ramipril. These drugs they block the angiotensin converting enzyme that cleaves the angiotensin 1 to form the potent vasoconstrictor angiotensin 2, and they are responsible for the breakdown of bradykinin, and also they decrease the secretion of aldosterone. That's why these drugs they reduce both cardiac preload and afterload, thereby decreasing the cardiac one. And they are useful in treating patients with chronic kidney disease and diabetes mellitus because they diminish proteinuria and stabilize renal function. The angiotensin receptor blockers, which are the valsartan, losartan, candesartan, talmisartan, and olmesartan, they block the angiotensin 1 receptors, decreasing the activation of angiotensin 1 receptors by angiotensin 2. And they have no effect on bradykinin metabolism. That's why they can be used as alternative to angiotensin converting enzyme inhibitors if the patient has a side effect like cough. Another antihypertensive group are the vasodilators, direct-acting vasodilators. And these drugs some of them are used as parenteral injections, and some of them are used as the oral drugs. The one that are used as parenteral injection are the nitroprusside, diazoxide, and phenoltopan. And also, the hydrolazine and minoxidil are used as oral medications. Nitroprusside and dilates both arterial and venous vessels, resulting in reduced peripheral vascular resistance. And this action occurs due to the result of the activation of guanylyl cyclase, either via release of the nitric oxide or by direct stimulation of the enzyme. And this will result in increased intercellular cyclic guanosine monophosphate, which will relax the vascular smooth muscle. And it is used parenterally to treat hypertensive emergencies. while diazoxide prevents vascular smooth muscle contraction by the opening of potassium channels, which will lead to hyperpolarization. And this drug is also parenterally administered to treat hypertensive emergencies. Phenoldiazepam is a peripheral dopamine 1 receptor agonist that is given also as an intravenous infusion, and it maintains or increases renal perfusion while lowering blood pressure. Hydralazine is a vasodilator that acts by producing relaxation of vascular smooth muscle, which will decrease resistance and therefore blood pressure. And it is accepted method for controlling blood pressure in pregnancy-induced hypertension. And it is always administered in combination with a beta blocker to balance the reflex tachycardia, and also in combination with diuretics to decrease the sodium retention. Another drug that reduces blood pressure through vasodilation is minoxidil. Minoxidil causes by dilation of the resistant vessels, which are the arterioles, but it does not dilate the venules. And this mechanism of action is due to the opening of potassium channels. This drug it also causes hypertrichosis, which is the growth of body hair. That's why it is used topically for alopecia. Calcium channel blockers are very important drugs in hypertension, especially for patients with angina or diabetes. These drugs they are divided into non-dihydropyridines and dihydropyridines. The non-dihydropyridines are verapamil and diltiazem, while dihydropyridines are nifedipine, amlodipine, phenoldiazepine, isradipine, nicardipine, and nislodipine. The difference between dihydropyridines and non-dihydropyridines is that dihydropyridines, especially verapamil, has significant effect on both cardiac and vascular smooth muscles, and they cause negative inotropic and chronotropic effect. While dihydropyridines have much greater affinity for the vascular calcium channels than for the calcium channels in the heart. Another antihypertensive drug group are the alpha receptor blockers. These drugs include the selective alpha-1 receptor blockers, which are prazosin, terazosin, and doxazosin. These drugs they selectively block the alpha-1 receptors in the arterioles and venules, and they decrease peripheral vascular resistance and lower arterial pressure by causing relaxation of both the arterial and venous smooth muscles. And they cause less reflex tachycardia than the other non-selective alpha blockers. Central acting adrenergic drugs are methyldopa and clonidine. Methyldopa is metabolized to alpha-methylnorepinephrine, which stimulates the central inhibitory alpha-adrenergic receptors and causes false neurotransmission and reduction of plasminogen activity. Methyldopa is also a drug that is used for patients with pregnant conditions. Clonidine is also a central acting adrenergic drug that acts as alpha-2 agonist, and it diminishes the central adrenergic outflow, decreasing the amount of norepinephrine release. So if the patient has hypertensive emergency, which is when the systolic blood pressure is more than 180 or the diastolic blood pressure is more than 120, the blood pressure should be aggressively lowered within minutes to 1 hour by no more than 25%, and then lowered to 160 over 100 within the next 2 to 6 hours. And the drugs that can be used for this condition are all given intravenously, which are the sodium nitroprusside, either labetalol, phenoldiazepam, or nicardipine. Thank you for watching this video. I hope you have enjoyed. See you later.